a presentation that I made on October 22nd at Humboldt General Hospital. The presentation covered a study completed by the University Center for Economic Development at the University of Nevada, Reno, which estimated the operation and construction impacts of Humboldt General Hospital on the economy of Humboldt County. The study will soon be available on the University Center webpage, and when that publication is available, we will be sending social media information where people can get a copy if they desire. The PowerPoint is divided into 3 sections. Part 1 will provide an overview of healthcare sector and its critical part that it plays in rural economies, not only in the present but also for future economic development. Part 2 will discuss the elderly population, our growing elderly population, and its economic impacts, especially with healthcare in many of our rural areas. And Part 3 will be discussing the economic, labor, and labor income impacts of Humboldt General Hospital's operations and construction in the Humboldt County economy. The authors of this study are Ethan Gumstruck, who is a graduate student in the economics department at the University of Nevada, Reno. Myself, Tom Harris, I'm a professor in the economics department in the College of Business at UNR, and I'm also the director of the University Center for Economic Development. I'm also a faculty member of the Nevada Agriculture Experiment Station and the Nevada Cooperative Extension. I am a state specialist in community and economic development. John Packham, the third author, is the director of the Health Policy Research, Office of Rural Health, Statewide Initiatives with the University of Nevada School of Medicine. The study is also part of a national cooperative extension program called Rural Health Works. The program looks at rural health issues and helps rural communities throughout the United States to look at their rural health care and the essential part that rural health care plays in current and future economic development. Before going through the PowerPoint, the authors would like to thank Jim Parrish, the CEO of Humboldt General Hospital, and his staff in providing to the authors information on the operations of Humboldt General Hospital. This information was essential for us to derive the economic impacts of operations of the Humboldt General Hospital. We'd also like to thank Mike Shepard of Michael Clay Corporation, who assisted us in collection of data, cost data, and labor data for the economic impacts of construction activities by Humboldt General Hospital. Basically, an overview of the study is that Humboldt County residents should be aware that Humboldt General Hospital provides access to vital health care services 24 hours a day, 7 days a week, and 365 days in a year. Also, not only for health care services, they need to be aware that the role the Humboldt General Hospital plays as a major contributor to the economic activity of Humboldt County. This is often overlooked by many people in rural economic development, and I also think urban development. Hospitals, health care play a very big part in current and future economic development for a community or a county, in rural or urban. As I said, this is part of a national effort, rural extension effort, and from the national center is the National Center for Rural Health Works. As you see, there's the address for National Rural Health Works. Gerald Dukeson, a professor at Oklahoma State where I got my doctorate, is the leader of this program. Gerald has done numerous programs on healthcare and rural healthcare and has been instrumental in people looking at rural healthcare as an instrumental part of any economic development program. Rural Health Works programs are these 4 segments that I look here in the model. Economic impacts is the one we're going to be discussing. Economic impacts is the economic activity, the employment, and labor income. Labor income is the addition of employee compensation plus proprietor income. So the labor income impacts of healthcare is the operations of the Humboldt General Hospital, and when Humboldt General builds new construction, those impacts. Community health needs assessments are things that we also do in this segment, the national program. John Packham's office has been very instrumental in that. And rural health needs assessments are another one that John's program has done. We have also done rural health services on feasibilities of these services to give rural communities or rural hospitals an idea of the feasibility of different expansions of different health care operations, kidney dialysis, those kinds of things that could happen. We provide that kind of information as an extension to provide information to the public and the operation as to the feasibility of this new development. In addition, Nevada information, if you want Nevada, we have it at our University Center for Economic Development webpage. We've done Nevada studies on healthcare and its impact through the Nevada Rural Health Program. We do these for all 17 Nevada counties. Now, in Nevada, 17 counties, not all have healthcare sectors. 2 do not, but what happens for these other counties, we show what the economic impacts of healthcare, not only for the current but also for the future. To review these past studies, you can use this web address to look at these studies, or contact me and I'll be glad to send you any kind of study you may want to look at. Contacts for Rural Health Works are these. Myself, Thomas Harris, I'm a professor and director of University Center. You see my phone number, 775-784-1681. The email is harris@unr.edu. Or John Packham, who's the director of Health Policy Office of Statewide Initiatives, University of Nevada School of Medicine, 775-784-1235. And you can see his email below also. This will conclude this introduction, and we'll be getting into the part 1, 2, and 3 of our study. And again, if you have any questions that you have on the study or this PowerPoint, please contact John Packham or myself. Thank you.